My name is Dr. Subodh Kansal. I am a physician working in Delhi in Shri Agarsen International Hospital, Rohini. I run my own clinic also by the name Pediamed Care Clinic in Rohini, Sector 3, Pocket F22 in house number 6. So basically, I will be letting you know about latest updates in hypertension. As per WHO, nearly 63% of total deaths in India are due to non-communicable disease, of which 27% are attributed to cardiovascular disease, which affects 45% people in 40 to 69 age group. Raised blood pressure is among the most important risk factor for cardiovascular diseases. Moreover, it remains poorly controlled due to low awareness and about hypertension, lack of inappropriate care through primary care, and poor follow-up. In India, the prevalence has gone up over 30 years to 38% in men and 32% in women, from 29% and 28% respectively. This is the WHO data. Despite that, nearly half of the people, or 51% of the men and 41% of the women with hypertension, were unaware of the condition. Additionally, over 62% of the men and more than 53% of the women living with hypertension did not get treatment. Medication was used to control blood pressure in fewer than 1 in 5 men and 1 in 4 women with hypertension worldwide. International Society of Hypertension has released the ICH 2020 Global Hypertension Practice Guidelines. The inclusion of optimal and essential treatment paradigms attempt to address the issues that in resource poor settings. Optimal care refers to evidence-based standard of care, and whereas essential standards refer to minimum standards of care to allow specification of essential standards of care for low resource setting. The AHA-ACC has released a scientific statement in 2021 offering new guidance for management of stage 1 hypertension among patients with low ASCVD risk. Among low risk adults with stage 1 hypertension, blood pressure goal 130 to 139 systolic and 80 to 89 mmHg diastolic blood pressure management starts with non-pharmacologic therapy. If blood pressure remains uncontrolled at 3 to 6 months, consider starting pharmacologic therapies. Lowering blood pressure targets down to 110 to less than 130 mmHg range substantially reduces CV adverse events in step randomized trial, affirming the sprint finding for an older Chinese population. Among some 8,500 patients aged 60 to 80 in China, the intensive target trimmed 26% of the composite CV risk. Findings from now a second major trial supporting a lower target could unite the guidelines. With regards to prognostic value of ambulatory blood pressure monitoring and nighttime blood pressure, the 2018 European guidelines on the management of arterial hypertension recommend that the diagnosis of hypertension should not only be dependent on office BP measurement, but also on out-office measurement, such as or home blood pressure monitoring. 24-hour and nighttime BP measurements were associated with greater risk of mortality and a composite of cardiovascular outcome. Thus, they may be considered as the most relevant measurement for estimating cardiovascular risk. For every 20 systolic and 10 diastolic mmHg increment in blood pressure measured at night, the risk of mortality increases by 23% and the risk of cardiovascular event by 36%. Most patients with hypertension require lifelong medical therapy to achieve optimal blood pressure control. The 2018 European guidelines equally recommend 5 classes of antihypertensive drugs. Considering high non-adherence treatment, the importance of combination treatment is particularly highlighted to improve adherence to therapy and blood pressure control. Therefore, the 2018 European guidelines recommend, especially in the context of lower blood pressure target, to start antihypertensive therapy with an initial dual fixed dose combination of ACE inhibitors or ARB plus calcium channel blocker or diuretic. So my recommendation will be that in case you feel any kind of symptoms like perspiration, chest discomfort, palpitation, or if you find your BP raised incidentally, then please consult your physician and get your treatment started. Thank you.